All right, thank you for joining us at Beaverdale Books. We have a fantastic lineup of events this month. So tomorrow night we have author Forrest Lone Fight. Then we're part of the Poetry on the Prairie events in Perry, Iowa over the weekend. And we have Carol Rose Spalding coming on November 19th. And we have a whole list of events over there. That's just a smidgen of all the events that we have going on. And we also have it, of course, on our website and our Facebook page. Tonight, we are so pleased to have the honor of this program. In the book, Enough, Because We Can Stop Cervical Cancer, Dr. Linda Eckart draws on 30 years of global clinical experience, weaving together powerful stories from cervical cancer survivors across 6 continents. She sheds light on the deep inequities in women's health, calling for urgent action to make prevention accessible worldwide. This compelling book is both a hopeful and urgent call to action, reminding us of the human cost of allowing a preventable cancer to persist. Linda challenges us to prioritize women's health and to confront the systemic barriers that impact the lives of millions. Linda is a professor of obstetrics and gynecology and global health at the University of Washington. She has over 30 years of patient care experience in Seattle and worldwide. A longtime consultant to the WHO, she's collaborated extensively with the American College of Obstetrics and Gynecology and the CDC, and she's renowned for her expertise in HPV vaccinations and cervical cancer prevention. She recently worked with Pakistan's Ministry of Health to help launch an HPV vaccine program for girls back in August of this year. Dr. Eckert will be joined in conversation by Morgan Newman and Emily Hoffman, and they are 2 passionate cervical cancer advocates. Morgan Newman, MSW, is a resilient young adult cancer survivor who overcame metastatic and recurrent cervical cancer at age 24. Since 2017, she's been a survivor ambassador, driving global advocacy efforts and serving in leadership roles with organizations like Survivor Inc. and the Iowa Cancer Consortium. Come on in. Morgan's dedication has earned her widespread recognition as a leading patient advocate in the fight against cancer. Emily Hoffman, a 10-year cervical cancer survivor, was diagnosed at 30 with stage 2B cervical cancer. Is that correct? Mm-hmm. She discovered her advocacy voice after attending Survivor School in 2016 and now works to raise awareness about cervical cancer prevention and the importance of screenings. Emily has received several accolades, including the Survivor Spark Award and the Survivor Champion Award, and she became a certified cancer registrar in 2023, fulfilling a long-term goal. So please join me in welcoming Dr. Linda Eckart, Morgan Newman, and Emily Hoffman.
Thank you, Jan, and thank you to Beaverdale Books for having us this evening, because we have a very important discussion ahead of us tonight. And we really want to start off the conversation with Dr. Eckert. If you can explain cervical cancer and how it starts, HPV, any of the little 101 nuggets.
Oh, thanks. And how's the mic? It's okay? Okay, cool.
Everybody here?
And I also just am so honored that you would come out tonight. I mean, we've all had quite a robust last 24 hours, and to have people show up in the evening like this, I think just is really honoring. So I really thank you. So cervical cancer, preventable. If you think about cancer preventable, those 2 words are usually not together. So how is it preventable? So it's preventable because we know what causes it. Cervical cancer is a unique cancer because it's almost all caused by a virus. It's caused by human papillomavirus, which is a very common virus. 80% of adults will have it, but there's 12 types of HPV that can cause changes that can lead to cancer. And fortunately, most people, if they catch HPV, that goes away. It goes away 80% of the time. But for the people where those cancer-causing HPV types persist, eventually it can become precancer. And then, if the precancer, even the precancer can go away. But sometimes the precancer persists and moves into cancer. And typically, we think of this as taking many, many, many years. But it doesn't always, like a 24-year-old with cervical cancer. But because it typically takes many years, we have chances to find it along the way. We can prevent the infection that causes cervical cancer and other cancers with the HPV vaccine. The HPV vaccine that we use now will prevent 90% of cervical cancer, but it is best used if it's given before there's any exposure to HPV. And because HPV is transmitted by sexual contact, it carries a lot of stigma. So there's been a lot of challenge in talking about the HPV and talking about preventing cancer, and that's been probably one of the things that we'll talk about. But so HPV vaccine, amazing tool, amazing prevention. It's crazy how good it works. Then the next thing we can do is a pap smear or testing for precancer, which is cervical cancer screening. And that is also an effective way to find cervical disease before it becomes cancer and then treat it. And then even when cancer is found early, there is a way to treat it and save lives, although the cost of that is quite dear to individuals, and I think we'll hear more about that too. And so it's a unique cancer because there's so many ways to prevent it. The other thing I would say about HPV is we're talking about cervical cancer because globally that is the main cancer that is associated with HPV. But in our country right now, more people are dying from HPV leading to throat cancer. I think it's kind of a well-kept secret that 70% of throat cancer is actually caused by HPV type 16. And that is prevented by the vaccine. And that's one of the reasons why girls and boys are recommended to get the vaccine, is because there's cervical cancer and there's throat cancer. There's also vaginal cancer, penile cancer, anal cancer, and vulvar cancer that can all be caused by HPV. So you have 6 cancers that this vaccine can impact, which is an amazing statement. And so cervical cancer, despite all of this, is increasing. In the U.S., a woman dies every 2 hours from cervical cancer. And globally, a woman dies every 90 seconds from cervical cancer. And so if you think about the fact that we know how to prevent it and what causes it, yet it's increasing and all of these individuals are dying, it's one of the more compelling arguments, I think, for trying to advocate for it and do more about it, because we don't need a lot of basic science research and we don't need, expensive NIH grants. We just need to figure out how to get these resources out there so that we can save lives.
I really appreciate you taking the time to explain that to everyone. For those of you who are not familiar, the rates in Iowa, we are the second in cancer diagnoses, second in the nation. So we have a lot of work here left to do. And unfortunately, with the new registry numbers, cervical cancer is starting to peak in on a top 20 of cancers again. Now, most gynecologists don't write a book. What compelled you to write a book about the global inequities and disparities, we should say, of cervical cancer? Can you talk about that and maybe give us a little bit of a reading to set the scene?
So, I never thought in any wildest dreams I would write a book, but I've taken care of women all my life, and when I was 25 was when I was in Liberia and I saw my first case of advanced cervical cancer. And in Liberia at that time, which was 1987, You know, there was not even pain medicine. There was not even anything we could do for this person. And that just really stuck with me. And then when I came back and finished my training in the United States, and I worked in Nicaragua, I worked in Kenya, and all these places, you'd see these people with this advanced cervical cancer. And so I quickly realized that this was something that I wanted to try to devote energy toward. And then the HPV vaccine came out, and I was so excited. I was like, oh my gosh, this is amazing. And I still can remember sitting in a conference hearing about that for the first time. And I thought, this is it. But then it stayed on the shelves, and it didn't get used. And so that was a really hard thing. And so finally, in 2018, I was at the World Health Organization, and they launched this global elimination effort for cervical cancer. They were getting ready to launch it, which was super exciting. But I remember sitting around this big table. There's like 50 people. You have your little name cards in front of you, and we're talking about what do we need to do to launch this global effort for cervical cancer elimination. And I just remember looking around this table and thinking, where are the women? Where are the voices of the women that are impacted by this disease? And that night I went back and I was writing my journal in my hotel room in Geneva, and I said, I have to write a book. I have to write a book that tells these women's stories from all over the world and puts behind it relatable information that everybody can understand, so that you can take the mystery out of this disease, you can take the stigma out of it, put a real face on it, and help people understand how we can prevent it. Because surely if people knew that we truly have enough to prevent it, they would also say, I've had enough. We don't need this. So that hatched in 2018, and then I worked starting in 2020 on the book, and I hired a book coach, and I worked for 3 years writing, and I interviewed amazing individuals, and then the book came out last January.
And do you want to talk about what that experience was like, interviewing survivors like Emily and myself?
Yeah, I mean, well, first of all, just the idea that individuals who didn't know me would trust me to tell me their intimate stories about their cancer diagnosis was so, I'm just going to cry thinking about it. No, I didn't sleep a lot last night, so I'm probably going to cry very easily.
But you're allowed to cry. It's okay.
But I was so honored that people would take a risk on somebody and share their story and say, yeah, you can publish it in a book. And it was so honoring to me. And then I found the stories through all kinds of different ways and different connections, and this organization Survivor that they're going to talk about is one of the ways where I reached out and people shared their stories, and globally there's different organizations and so forth, and I've worked overseas, so some of them are my own stories. But I felt like, I'd been a gynecologist for 32 years, and I felt like I really understood this disease. But I was so taken aback about what I learned about survivorship, about what it's really like to live with this disease. And so I feel like I learned so much from both of you, from your stories, from other people's stories, and it's really impacted me as well.
Well, and thank you for giving us that platform too, because sometimes that's the hard part is finding the right areas to share our stories in that capacity. But you've made it super easy for us to be vulnerable and to share what really impacted us as well. Do you want to go ahead and do your reading?
Sure. How the book works is that there's, in each chapter, there's at least one or two stories that kind of present an example of what the problem is that we're talking about, whether it's what's HPV or what are some of the inequities. And, I guess since we just had this election where one of the things that was talked about so much was women's health and equity, I'll read a story that kind of captures some of that information. And this is in the chapter called Putting Out Fires, which is about screening and the challenges to screening. And this is a subsection called Money, Money Everywhere, and Still the Fires Burn. While having the financial resources on paper, higher income countries face unique funding obstacles with regard to cervical cancer screening programs. As a result, even persons with cervixes living amid affluence struggle to stay on top of screening requirements. Per capita health spending in the United States is over $13,000 US per person, but that amount is not offered to individuals equally. And with no universal funding for health care, spending on health varies greatly from state to state, and women on low incomes go without care in shocking ways, often with tragic results. As a doctor who's worked in a number of clinics servicing people who rely on state medical funding, I've seen firsthand the complex array of reasons that women don't always get properly screened or treated for precancer or cervical cancer. And poverty is one of the most disheartening of them all. Angie was just such a patient at a clinic in Brownsville, Texas, where I worked after finishing my residency. I spoke with Angie about her experiences with cervical cancer. She was a petite woman with expressive brown eyes, and she exuded warmth from the time I first saw her. Angie first came to the Brownsville clinic when she was 36 years old. A single mother, she'd been working full-time in a nursing home for $11 an hour while caring for her live-in mother and her own 2 children. She understood the importance of cervical cancer screening, but had gotten behind on her pap smears. And with no health insurance from her job, she just couldn't afford doctor visits. Angie's situation is strikingly common in her state. In a study of Rio Grande, Texas, of women without health insurance, it found over 70,000 women were behind on cervical cancer screening, and only 10% of women actually were up to date in this population. But this problem isn't limited to Texas, because an estimated 7.9 million women in the United States lack health insurance. And in the United States, a pap smear costs a minimum of $100 US, including the clinic and the visit and processing. And patients without health insurance or access to subsidized clinics, follow-up that might be needed, such as a colposcopy or biopsy, can cost upwards of $1,000 US. In other words, for U.S. women trying to address precancer early enough to avoid a devastating outcome, cost and access to specialist services gets seriously in the way. Some clinics, like Angie's in Brownsville, offer sliding scales based on government state allotments, but when funding runs out, patients must pay out of pocket or return the following year. And these funding delays allow undiagnosed cervical cancer to further advance. As a result, people like Angie are left vulnerable, subject to low-cost or government-funded options particular to their own state, which varies based on the governing majority and its preferences. Angie came initially to a pap smear one August afternoon, but she was told that that clinic had used up its annual budget for low-cost pap smears, and that she would have to pay the regular $100 US fee, which was well outside her budget. So that August, she made a mental note to come back in February the following year to get a pap smear. She would give it to herself for Valentine's Day, she told me. So she did come back to clinic that February following for a routine exam and pap smear. And 3 days later, she got what she calls, quote, the phone call that changed my life, unquote. Like almost every woman I've spoken with who received a cervical cancer diagnosis, she could recall specific details even 5 years after the fact. I was sitting in a crowded break area for employees at the nursing home when the clinic called to tell me my pap smear came back suspicious for cervical cancer. She paused as she spoke to me, her eyes welling up. I had to get up and turn off the TV playing in the break room to make sure I was hearing the words correctly. I remember asking the person on the phone if I was going to die and thinking to myself, who would take care of my children and my mother? Because for them, I was the only one. Well, thankfully, Angie's screening test led to a biopsy which confirmed her cancer was still in an early stage, and she received her follow-up care, Ironically, it's only after she received a cancer diagnosis that she qualified for government-funded emergency insurance to cover her radiation treatment. And 5 years later, Angie is a cervical cancer survivor. Given her circumstances, she is one of the lucky ones. And I think this was a story that, like so many of the clinics where I've worked that are for low-income people, if you really don't have insurance, you really don't have access.
And what stands out to me in that story is the detail of when someone gets their diagnosis. Emily, I want to invite you into this part to talk about your story and how you accessed your screening as a young adult.
Yes. First off, how's my microphone? Good. Okay. Actually, yeah, and I'm thinking of that story and how going from August to February and what a difference that makes, because that's kind of how my diagnosis was and the story started, because I went every year for my just annual exam with my primary care physician, and the year before was fine, and the next year had a 4-centimeter tumor on my cervix. So, you know, it's always that what if of, oh, what if I had put it off that year and thought, oh, I got too busy, or just had skipped a year. Like, the difference a year made for me in my diagnosis. But now I'm an 11-year cervical cancer survivor, and I think diagnosis and treatment pretty much for me went pretty smoothly. I had chemo and radiation and got through that pretty well, but then for me, after a few months after treatment ended, started having side effects from my radiation treatment, and that meant, like, it was hard to eat. I was pretty much throwing up everything I ate, or would get in these bad intestinal cramps that would just knock me out, and like I'd literally be in bed for like 12 to 24 hours at a time, and missing work, obviously, and not functioning a lot. And so I would tell people, like, I literally spent my 30s sick in bed, because it's like that was life for the next 8 years. I went around to multiple doctors and tried different things, but to manage my symptoms, but nothing really worked long term. And so, yeah, that was kind of just life for 8 years after treatment. So, you know, getting through 6 months of treatment was easy compared to life after cancer. And I think that's why, part of why I share my story, is because cancer doesn't end when treatment ends, and there's so much more to it. Even without my physical side effects, there's just a lot emotional and everything else after cancer. But ended up that I ended up getting to my lowest point about 3 years ago, and so got to my last resort, which was TPN, and so that has been life-changing. And what
did you explain TPN?
What is TPN? It is total parenteral nutrition. It means I get all of my nutrition through a vein in my chest, so I can bypass the digestive system completely. I can still eat and need to, but not to get all my nutrition. So what does that look like? It's a bag of liquid formula, IV bag that is connected to a pump and put in a backpack, and I'm hooked up to that 12 hours a day. So I run it overnight, but obviously I'm not sleeping 12 hours a day, so there's a few hours I gotta carry a backpack around. And if that sounds like a lot, it is. It's hard. Like, I laugh about it, but like, it's hard. It's a lot of work, but it's life-changing for me. I'm coming up on 3 years on it now, and in January, which is crazy, but I've gained 20 pounds, and I'm not throwing up, and I feel good, and I'm upright and functioning every day, and going to work now, and so it's just been, like, life is now back to normal. At least I feel better. So,
but there was a point where access to care became a question for you as well, and that is after cancer. Can you share just a little bit about that too?
And I think that's more, related to, getting access to care here with rural, being in a rural area and then insurance changes and things. We just don't have a lot of options. And then if your insurance does change, and then there's nowhere to go locally. And then the only place is out of network and far away. And I think there's just, I feel like your healthcare after cancer, we know what you need, but yet you have to work and be such an advocate for your own care and to continue your care and make sure that you get continued care or you'll lose it.
I agree. And so my story is somewhat similar to Emily's. I was very consistent with going to my regular screenings every year. And had I not gone that year, I wouldn't be sitting here talking to any of you. I was someone who frequented Planned Parenthood for my preventive health care when it came to my female exams. And I received my first abnormal Pap test. And so I didn't think anything of it because a lot of my friends had experienced at least one abnormal Pap and they were okay. And so I went back and had to have a colposcopy, and it was then that I was hemorrhaging on the table as they were doing the procedure that they stopped and they're like, oh, something's seriously wrong, we need to refer you onto a gynecologic oncologist. And hearing those two words didn't click for me. I think it was a bit in denial, like, I don't even know what that means. I'm 24 years old. Nothing can be wrong. And so I went and had the biopsy done at that provider's office, and he had told me to get dressed and meet him in the conference room with his assistant. And it was then that I was diagnosed with cervical cancer. And ironically, it was World Cancer Day. Yeah. So if you believe in fate in some ways, I think I'm supposed to be here doing the work that I'm doing today because of it. But I went through chemo, internal and external radiation. The first time I was able to hide that I was sick, I didn't lose my hair. And then I went back for a 6-month checkup and found that my cancer had returned to my lungs. And so I had to go for a second opinion and ended up going through a heavier dose chemo regimen. And my oncologist at that time had told me that I had a 7 to 9% chance of being completely cancer-free. Otherwise, I was going to have to live with it or I would die. And so that was a really rude awakening, and I was seeking out ways to make a difference. When I was going through treatment, I had a community here in the Des Moines area that really stepped up and did some fundraising and that kind of stuff for me. And during those events, I would pass out little teal ribbons because that's what I could do to raise awareness. But I wanted to do more. And so I stumbled across Survivor on Instagram and saw that there was a whole program that I could go learn how to be a patient advocate, and what better way to do it than behind a very well-respected organization. And so I did, and then the same week I came back, I met Emily. I met Emily because our founder, Tamika Felder, was speaking at our Iowa immunization conference. And so we saw each other at the table. She noticed on my name tag that I was from Winterset at the time, and she leaned over and whispered to her dad, "She's from Winterset." Like, super excited. Yes, I remember this because that was a pivotal moment, because I didn't know anyone around my age that had lived, or, there wasn't much of a presence, of cervical cancer, because a lot of people just don't talk about it. And so we really, bonded and started working together, where Emily's not so social media based, and I am.
Yes.
We even each other out.
Each other well.
But to wrap up my story, I am now 8 years cancer-free, and continue to be disease-free, but I also deal with post-treatment side effects. I look fine, but boy, the stomach issues, you know, Emily was there to give my my anxiety a little bit of rest. Like, she gave me, oh, yeah, I think you might have some radiation enteritis. You need to ask your oncologist about XYZ. And having that peer support, like, really helped navigate some of those the bumpy roads. But yeah, it's been quite a journey. But we were able to connect with Dr. Eckert and share our stories and hopefully impact others globally with this ending cervical cancer, because it goes hand in hand with our mission at Survivor.
So in the book, Morgan's story is centered around the HPV vaccine. Do you want to talk a little bit about that?
Sure. You know, I was, 15 or 16 when the HPV vaccine was first launched, and I did have a public health nurse tell me about it, but that was it. And I told my mom no, I wasn't going to get it because it was too new. And I think my famous last words to her was, "That'll never happen to me." And then 8 years later, I got diagnosed with cervical cancer at 24.
And so her story that she graciously shared is in the context of, she's not unusual for not taking the vaccine. You know, when the first decade it came out, really at first only 20% of individuals took advantage of this vaccine in our country. And I think the year it rolled out, only 17% took advantage. And it's been a really slow climb, and now in Iowa it's about 50%. But only 50%, right? I mean, some states, like Rhode Island, it's 90%, because there it's a school mandate for 8th grade. In Mississippi, it's 30%. So it's really all over the place in our country. But I think the point that I make when I'm writing about this is how we just need accurate public health information and programming, because when the vaccine first rolled out, I think we made a lot of mistakes. We talked about this is a HPV, which is a sexually transmitted virus, and then everybody said, oh, don't need this, especially for my girls, they don't need this. And we didn't really talk about the fact that this is a cancer-preventing tool nearly as much. And I think it's taken a long time to get that story back. And that's been true globally. Almost every place it's been rolled out, there's been pushback, especially by religious communities, or even sometimes health providers sharing information that isn't accurate about side effects or concerns about long-term side effects. And it's just been really hard. And if you think about it, hepatitis B is another cancer caused by a virus. And we give that, and it's also sexually transmitted. We give that to babies. Nobody even asks about it. You just get it, you know. And so I feel like the HPV vaccine story has just been so convoluted and difficult, and how it's still, you know, I'm so glad you guys are here and care about this, because I think this is really how we get accurate information out. It's just word of mouth as well as the public health programs.
I do want to add, because I feel like a lot of times we'll bring like this global perspective into our communities, and you may not think, oh, this isn't happening here, but it is. You know, there are policies that are coming into our legislature that is not it's not making it a requirement to teach at schools, and we have to think of those people that may not have access to that information outside of schools. You know, we're doing a disservice not giving the information out, and I just want to be aware. I want us to be aware as a community and as a state that with our rates as high as they are, we really do have a lot of work on education and prevention that we need to do.
So I'm curious for you two, what's it like to see your story or your photo in this book, you know, that's published? Because I think it kind of takes a lot of chutzpah, you know, to put yourself out there and do that.
Okay, like for someone who like was slow to advocacy and sharing my story, and even now like obviously don't talk a ton about it, or if I don't have to, but yet I do it. I am really excited about seeing my story and my photo in there, and I actually love it, and I'm proud of it, and I'm proud of the book as in general, but like, yeah, to be a part of it is just an extra little bit of icing, but I'm really proud of it. For me, I don't know, it's easier for me to share my story in that because I feel like I can still maintain some bit of being anonymous, as opposed, but yet get my story like out there and reach a lot of people and share it with a lot of people. But you know, doing something live or like this, I lose that bit of being anonymous.
Yeah, you just take that.
Yeah, this is a smaller scale, so it's all right. So I kind of like this avenue of getting my story out there.
I'm kind of the opposite. Well, not the opposite of like, I'm really happy that I did share it. That's not,
Yeah.
I'm not saying a negative, I promise. I'm all for sharing my story. You know, that's kind of where I'm going.
Obviously.
But it's still kind of surreal that it's out there and such
Like in print?
yeah, like it's very surreal. But not only that, but the publicity that we do in media outreach for spreading the awareness that this book is out with a very strong message. And I'm with Emily, I'm very proud to be a part of that. And, you know, I now work for the organization of Survivor. So I'm very proud that our community has stepped up to share their stories as well, because that is part of our mission, to make sure that we end cervical cancer. But we are also empowering others globally to share their stories. And so it just goes hand in hand with what we do. But it does not get easy to see your face up with the publicity. Dr. Eckert had reached out to the Today Show, and they accepted Anna, myself, and you in an article, and they just reshared it this week.
Oh, I didn't know that.
They
Okay.
just reshared it. I think it was Monday, maybe. But I'm just like, does that ever get any easier? Because it's like, oh God, all your business is out there, but you're doing it because you care and that you don't want others to go through what you've been through. You want people to receive the same message that you're putting out. You know, like, hey, don't make the same mistake I did, because we do have the proof that the vaccination and screening efforts are working together. Yeah,
And I think
we have the tools.
that's why I said yes to talking to you for the book, because at the time I was like right in the height of my being so sick, and I wanted people to know how hard cancer is. Like, and I like selfishly just, even though my story, like in the book, I think I focus, like my story is about my side effects, because cancer's hard and my treatment's over, but like life has completely changed and it is not fun anymore. And that's where I was at the time, and so I just wanted people to know that. And I don't think I would share my story if I had a different type of cancer, because cervical cancer, like, because it's so preventable, like I feel like I have a purpose and more to like what I just went through because of the type of cancer I had.
I love that you just said that, because there's someone who's passed in our community that shared, you know, that she was told that cervical cancer was the easy cancer. And I think there's a misconception that abnormal pap tests are cervical cancer. It's not always the case, and Dr. Eckert, you can attest to that. But that's the narrative that people are telling themselves. oh, that's an easy cancer. You have one of the good cancers. This is to share, our stories, and then the women across the globe that are sharing their stories. It is just as hard as any other cancer. There are people still dying every 90 seconds. It's a huge epidemic, and it can be prevented. But I do have a question, and it might be a little crazy, but what in your wildest dreams do you see this book doing, or what would you like to see out of the book?
Well, I think anytime you spend 5 years working on a project, you want everybody to read it. And I really wanted this book to help be another tool that moves cervical cancer conversations and HPV cancers and prevention into the mainstream. Because I feel like it is still stigmatized because it's a below-the-belt cancer. And especially in other parts of the world, it's even harder to talk about even than in our country. And so I just really wanted a lot of people to read about it. And, I wanted to be on the Today Show. I wanted to be like on Oprah's book clubs. I wanted, I just wanted everybody to read it, not because I need to be famous. The stories are really, the book is really you guys' book. It's your stories with information behind it that I hope helps people understand the disease. But mostly I just really wanted people to be able to learn about this, because this is it's so tragic, really. If you think about what women offer to the world, and if you think about what we know about what happens when you lose the maternal unit out of a family, or you lose one of the main people that makes money for the family, and especially globally, it's almost always the women that are carrying the financial burden, the emotional burden, they're caring for their communities and everything, and then we have this preventable cancer, and we're not preventing it.
And I think you have a chapter or a section of what is a woman worth. Do you want to talk about that just a little?
Yeah, I think that, stepping back and looking at the big picture, every health department has hard decisions to make. How are you going to spend your money? What are you going to choose to put resources on? And I think this is even more true globally, where they have sometimes, like in Malawi, they spend $100 per year per person on their health budget. And so they have done, the World Health Organization did study before they launched their cervical cancer elimination, looking at lower resource settings, looking just at screening, and it found out that if you spend, for every dollar spent on screening, you returned $3.20 back to the economy just keeping women in the workforce. But if you add in their unpaid work, if you add in, all they do for their communities, all the care they provide, etc., it's $26 to every dollar spent. Wow. So this is a public health intervention that has 26-to-1 return, which is incredible if you work in public health to have a 26-to-1 return. And so I do think if you look at it economically, it really makes sense. Of course, if you look at it as a way to keep children healthier when their moms are alive, they go to school more, they get their vaccines more, they, when children without a mother marry younger, it sets up this generational poverty. So you have a chance to try to interrupt this generational poverty. So there's a economic, there's emotional, there's societal. So people often ask me, how can you afford to do the interventions to prevent cervical cancer? And I just say, how can you afford not to?
Mm-hmm. Now, I kind of want to take a step back because I feel like I moved on to that question really quickly, and I forgot to ask you what you would like to see this book do.
Well, if I want to dream big, like Linda here, when I first made the connection and learned about the HPV vaccine, my dream was that, okay, then I'm going to see this cancer end in my lifetime, right? That was the dream. And so then with this book coming out, that's what I want my big dream to be, and that happens across the globe in my lifetime. realistically, like, and I will probably see it in some countries because we are seeing it happen, but everywhere, no. But locally though, and just like on like small scale, like I really just want, like, when I read it, I appreciated it as a cancer survivor, and I felt like a cancer patient or survivor, even a patient going through treatment, would benefit from this book. And so I just want a cancer patient or cervical cancer patient or survivor to read it and not feel alone, and like we have both felt at the beginning of this journey. But then also feel a little inspired maybe, and feel like maybe there's a little purpose to the pain that they're going through. And that maybe they'll want to share their story and join this, and then that's one more person sharing their story. So,
well, and also I feel like, when you're feeling so sick and you're going through treatment, and you guys are all family support care providers, and you want them to know what you're going through, but you don't have the energy to say it over and over again. I say, read chapter 6. Or just like there's good information about what is going on and what you're doing, and how it's impacting you. So I really hope that it would be on the American Cancer Society list or different lists of, if you need some resources to learn about this, this is an option.
I love that, and that's like a great plug because November is National Family Caregivers Month, so good one on you. But I'm with you guys. Like it's a wild dream, but I think it's an attainable dream to get the book into hands of people that need it the most, to educate them and make them understand just the impact that a cancer diagnosis, a cervical cancer diagnosis, has on someone's life. But not just theirs, it's their family structure, the economy. But there's so much more to a cancer diagnosis than just what stage and pathology. Yeah, like it is. There's so much more to it, and it would be such a dream to have a pivotal moment, just like Susan G. Komen had. Back in 1970, they were going through the same thing where women weren't allowed to talk about breast cancer. It was hush hush, and now look at them. They're incredible.
Yeah, NFL wears pink. Talk about advocacy.
Yes. But they also have Crucial Catch that has teal and white for cervical cancer too. So there's glimmers of hope that are coming through. There's a lot more conversation starting to happen. You have to be persistent and consistent to get your message across, and we're doing it, and we're doing it together because we can't do it by ourselves, which is the most important thing, making sure that we're doing this as a community. Is there anything else that you guys want to talk about that you feel like we may not have covered?
no, I'm good.
Imagine that.
I'd be really happy for questions or thoughts or things. Yeah.
I was wondering, I've read the book, and I realize in those countries where communication is difficult, care is not readily available and that. But in the United States, what is the attitude of the medical community? In other words, when a mother or a woman goes in to see a doctor, they go to a clinic, or is there literature there? Are they encouraged to get vaccinated? What is the attitude, the encouragement level, or is that one of the things that's holding it back?
Yeah, that's such a good question. And I don't know that I have the ability to speak for the whole medical community. So first of all, let me just say I'm humbled to answer that completely. But I do think if you look at the most of the American Academy of Pediatrics, American OB-GYN Society, Nurse Midwife Society, Family Medicine Society, this vaccine Society of Gynecology Oncology, all of the major structures in the country really pushed HPV vaccine. And that narrative has gotten stronger with time. And I think initially the pediatricians were a little slow to understand why did they need to give this vaccine to a 9-year-old or 11-year-old if they weren't going to have sex? And it took a while, and they also don't see precancer and cancer. You know, the pediatricians are really the people targeting the vaccine or family medicine, but they're not the ones that are seeing the 15-year later impact. So I think it took about a decade, really, to get everybody really on the same page, and also to change the message that this is about cancer. And once we started changing the message, and the CDC made a huge media change and targeted information about that, I think it's helped. But I've had patients tell me that, you know, providers are who they are, and I've had people say that their doctor said, oh, your kid doesn't need this, don't worry about this. So, you know, I think stigma and ideas die hard, and I would say that doctors are some of the most arrogant group of people in the world. And they think that guidelines aren't meant for them, that they are smarter than the guidelines. So I think it's been a difficult battle, but I do think it's getting better. The interesting part is that another level of advocacy is for patients and moms and kids demanding it. And that's why the education in schools can be so helpful. And that varies a lot by state. And I think, you know, we don't quite know, but we may be heading into a time where in the next few years it's even harder to have these conversations openly about HPV or about the benefits of vaccination. We don't know. We're all kind of scared right now. And so I feel like grassroots communication, people spreading accurate information is going to be even more important right now.
I've got 2 questions. Have you two been vaccinated with the HPV?
No.
Would it do them any good to get vaccinated now?
You know, it's controversial. It would protect them from acquiring new strains.
Yeah.
And in precancer, there's some data that if you treat someone for precancer and you give them the vaccine and it ups their antibody levels, it may help them not to acquire precancer. But for cancer, it's controversial, and I think it really depends on the oncologists and the.
And my other question is, what are the side effects from the vaccine?
Yeah, well, it gives you a sore arm. It's got a lot of fluid in it. But, you know, it's been really well tested. There's been over 280 million doses globally given. It's been studied in many, many different ways, and there haven't been found to be any long-term side effects. It's a very safe, it's a protein base. There's nothing live about it. There's nothing to catch from it. It's a vaccine. We don't give it in pregnancy, but you could. There's nothing wrong with giving it in pregnancy. So it's been tested in so many different ways, and it's thought to be one of the safest vaccines because it's been looked at so closely because of all the rumors.
And I do want to step back a moment to the pediatricians and healthcare professionals, but also I'm a former dental assistant.
Yes,
and
dentists.
having head and neck cancer
Yes.
be a serious concern. It is surpassing cervical cancer rates here in Iowa. The dental community is just now starting to come around to that. I've seen that in our advocacy work that, you know, I really was super passionate about it when I was still in the dental field, and I still am. And part of my reasoning is I went back to school for social work and finished my master's, but as part of my practicum I worked with Natasha Askelson at the University of Iowa to develop an education program for dental professionals in order for them to become more aware and do more of an advocacy role because their provider recommendation matters as well. Yeah. And so there's different providers that we're looking at, and they're starting to do the work. It has taken time because they never thought they'd be here. Now we have I think it was Oregon. There's
In
dentists.
Oregon, dentists can give the vaccine in their office.
Yeah.
In New Mexico, they do. It just varies state by state. In Washington, you can't give it in your office, but you can recommend it. It does vary state by state, but that's a good example. Another thing we were talking about is school nurses, right? I think school nurses really could benefit from knowing this. So I'm trying to figure out if anybody knows how to get to school nurse organizations, just to offer the idea of this as an education.
We just spoke at the school nurses annual conference this summer.
Okay. Yeah.
I mean,
They were a very receptive audience.
Yeah, I mean, that's what Survivor does. As part of our patient advocacy footprint, we teach our community members, through Survivor School. That's our premier program where we teach people to, or I should say, cervical cancer patients and survivors how to become effective advocates, go out and make the community connections. And really it's kind of I don't want to say playbook, but it's kind of like, hey, these are the people that you should go make connections with in your community, share your story, be that resource for them in case they ever need you to share your story or have questions about HPV or cervical cancer. I mean, it's really part of our community building and our advocacy efforts.
Other questions? Yeah.
What are your thoughts on, is the vaccine focused purely towards girls?
Yeah, no, that's such a good question. I'm so glad you asked. Is the vaccine focused purely toward girls? Initially, in the first 2 years, it was rolled out in this country for girls, but then boys quickly added on. And, males get more head and neck cancer than females, 8-1. So, in an ideal world, all boys and girls should get vaccinated. Let me say, though, globally, there is a vaccine shortage for HPV vaccine. There are not enough doses available to vaccinate boys and girls globally. There's not enough of it made. And there's a real vaccine equity problem as well. If you pay full dose for the vaccine, like in this country, you can get all the vaccine you want. If you live in Pakistan and you're the government and you're trying to negotiate it at a lower price, you may not get that vaccine. And because girls globally, cervical cancer is way more common than head and neck cancer globally, etc. Currently, in most lower resource settings, only girls are vaccinated. I think once the supply improves, which China now has 2 vaccines that are WHO pre-qualified and approved. India is very close. Once we get a lot more suppliers, then I think that globally vaccinating boys and girls can happen. And I think that actually will help. I think it'll take away some of the fear of, what are you trying to do to our girls? Is this going to cause them to be infertile? Is this really a secret contraceptive method? I mean, there's all kinds of rumors that go when you're just addressing girls. So in this country, it's open to males and females. Globally, the supply shortage makes it such that girls are still the priority. But here's the good news. If you vaccinate 80% of girls, you interrupt the transmission chain and you get herd immunity. So like in Australia, they rolled out the vaccine in 2007, and they got like way good coverage in their teens and their young adults, females. And 6 months later, there were no warts in males because the vaccine also protects against warts. And so if you really vaccinated all the girls, at least for a lot of the world, that would be good coverage for the males as well. But the ideal is equity in vaccinating boys and girls. And in this country, that's the way it is.
And there's more countries rolling out with pretty compelling data, like Scotland.
Yes.
And Rwanda.
And also Rwanda and also Australia and Sweden. There's now really good data that for people who are vaccinated, like in 2008, and they're following them forward, they just aren't seeing cancer. I mean, it's so crazy. If you think about the flu vaccine, if we get 50% coverage, we're like so excited. And here you have this vaccine that can wipe out cancer. It's just crazy.
And that's part of our dream. Just to see that coming to life. It's within our reach.
Yeah.
Yes.
Are there any more questions?
Okay, well, thank you so much for coming. And I think we're going to have some signed copies, and we've had lots of people on Facebook watching, and so stop in the store and pick up a copy of the book.
Yeah, and I'm happy to sign copies and personalize them. I would say this, as an author, this is something I've learned, which is the power of Amazon reviews. If you, right now I have 38, if you get to 50, then when people Google women's health books, this book will come up. Ooh. I wish that algorithms didn't work that way, and I never knew anything about that as an OB-GYN. There's nothing about me that knows anything about this, but I've been learning about this little tidbit. So if you like the book, please leave a review.
Alrighty.
And then we have information about Survivor and some pens, and if you haven't grabbed a cupcake, please take one with you. That's what they're there for. I really
Thank you so much. Oh my goodness.
Yeah, I really appreciate the two of you.
I did all these interviews in 2020, and they ended up having to be on Zoom because of COVID. So this is the first time I've actually seen Emily, and
we've been like staying in touch, like through email and a few,
and then Morgan and I met last year at an international papillomavirus meeting. So for me, as somebody who like heard these stories and tried so hard to write them and digest them, it's just I'm in the same room. It's such an honor.
And she did it really, really well. There's some people who are just like, oh God, I hope they're gonna get it right. You did it right. You did it right, and we appreciate all the work and heart and dedication that you put into this book.
It is a heart for me too. Thank you. Thank you so much for coming.
You bet.
For hosting us.
Thank you so much.